Trauma is something that comes in a variety of degrees but can have devastating consequences for the individual that experiences it. There are a lot of misconceptions about trauma, and on this week's episode of GetPsyched, we're going to take a look at what exactly trauma is, what it's all about, and how it's best treated. What's up guys, welcome to another week's episode of GetPsyched, and like I said, this week we're going to be taking a look at what trauma is and how it's best treated. If this is your first time watching GetPsyched, then welcome. Make sure to hit that like button, hit that comment button as well. You can leave a comment for me and I'll get back to you. You can also share the videos on social media channels if you want. And you can also subscribe and hit that little bell next to the subscribe button to get weekly reminders every time I upload. Now, back to the video and back to trauma. And the first question that we have to ask ourselves is, what exactly is trauma? Now, the dictionary definition, which I looked up the other day, says that it's a deeply distressing or disturbing experience. Now, of course, this is a hugely, it's a wide definition, and in large, it probably kind of has to be pretty wide. It has to be a broad definition in order to encapsulate all the different kind of nuances and different forms of trauma. And in truth, this is exactly what trauma is like. It comes in many different forms. It's wide-ranging, and it can affect multiple different kinds of people in varieties of different ways. However, the definitions of trauma in psychological terms have had quite a bit of challenge in history. In the 1980s, the American Psychological Association said that PTSD, which is post-traumatic stress disorder, which we'll talk a little bit about in a minute, which is a form of trauma or experience of trauma, that in order to be diagnosed with PTSD, somebody had to have had a near-death experience or near-injury experience, or have witnessed somebody have a near-death experience or near-injury experience in order to be diagnosed or in order to be termed as having PTSD. Now, for you and for me anyway, I think that definition is a little bit strange, because as PTSD and our knowledge of PTSD has grown and our knowledge of trauma has grown, we understand that people can experience PTSD and they can experience trauma in situations out with near-death experiences. For example, somebody might experience PTSD off of being bullied at school. Somebody might experience PTSD off of experiencing rape. Somebody might experience PTSD off of really kind of a variety of different reasons. And in the 1980s, in a historical sense in psychology, that wasn't fully appreciated at first. So it's clear that we've come a long way since these early definitions of trauma. Trauma basically can be experienced due to numerous factors in life. So now that we understand a little bit more about the definition of trauma, what are the different forms of trauma? Now, what I'll say before this is that there are numerous forms of trauma, but I'm going to just have a look at a couple first. The first I'm going to look at is complex trauma. Now, this is when traumatic experiences happen repetitively in somebody's life over, a long period of time, and it results in direct harm to the individual. And that complex trauma often happens in a specific time frame, location, or context. For example, someone might experience trauma off of repetitive domestic abuse from a partner. That repetitive element of that trauma establishes this to become a complex trauma. It's happened over a longer period of time. It's location or individual or context specific. And so as a result, somebody who experiences domestic abuse might also experience complex trauma. The next form of trauma to look at, and one that I've just previously talked about, is post-traumatic stress disorder or PTSD. This is when somebody is exposed to a subjective traumatic event. Now make sure to consider a little bit about what I talked about earlier about the definition of trauma and PTSD and how that's changed and how our appreciation of that has changed over the years. It also establishes itself, PTSD establishes itself when somebody is in close proximity to somebody who maybe has had a life-changing incident, or maybe they themselves have experienced a life-changing incident themselves. Somebody as a result might be diagnosed or experience PTSD. PTSD often results in consistent traumatic memories or flashbacks, for example. Somebody that almost kind of relives a certain event that struggles to get past this traumatic event, and when that reliving happens, it's almost like that trauma is happening again. For example, a classic example, I'm not going to pretend to know or pretend that I know what this is like, but soldiers in war, for example, sometimes it's a classic example of PTSD when somebody maybe has had a near-death experience, or somebody has witnessed somebody have a near-death experience, or they've witnessed really horrible things. Soldiers often come home and can have elements of PTSD. Maybe that results in flashbacks or memories or recalling situations that have been really, really challenging to witness or be around. And with PTSD, I think you can understand a little bit about the complexity of actually treating this. If somebody has had such a horrific traumatic incident that they've experienced, reliving that constantly can be even worse. And you can imagine just how much that perpetuating nature of that traumatic event can have really negative consequences for that individual. Okay, the next form of trauma that I'm going to look at is developmental trauma disorder. Now, this is a recently new term in psychology. It's basically where a child in the first 3 years of their life develops a sense of trauma or experiences trauma in some way. Now, this could be due to things such as abuse, abandonment, or neglect, for example. And it can create issues both cognitively, biologically, and psychologically for young people. There can also be real issues in them attaching to caregivers, adult caregivers, as they grow into adolescence after having experienced these traumatic events in early childhood. Now, although this term is quite relatively new in psychology, we can look at psychological studies, psychological research from years ago and understand the impact of developmental trauma disorder. I'm not going to go into too much detail right now, but there is a classic example of Romanian orphanages when young children were shackled and strapped to beds. They basically weren't allowed any daylight, they weren't allowed any real interaction. They had no direct caregivers. Now, this might be a little bit more associated to attachment theory, something I've looked at on GetPsyched before. But without a doubt, they experienced an element of trauma. They probably did experience developmental trauma disorder. As a result, they had real negative consequences in being able to attach to adult caregivers as they grew older. And that's just a very brief and basic example of something that is much more complex than I'm just saying, but it shows us a little bit about the impact of trauma. It shows us what trauma can actually do and how it can be established in young life. Okay, so we've looked at the definition of trauma, we've looked at the different kinds of trauma, but what are the symptoms of trauma? Now, classic examples include things such as shock and denial of the actual event that happened. Sometimes when somebody experiences a trauma, it can be years, even decades, before they start to discuss the event that caused that traumatic incident. For example, I've worked with clients in the past who have disclosed sexual abuse incidents to me after decades of not speaking to anybody about it. They've had to live with that trauma, they've carried that trauma themselves, and only recently have they started to discuss that. And you can understand how challenging that must be, but how much therapeutic use there can be in people actually talking about this event. Things such as flashbacks, sadness, and anger are also classic symptoms of trauma. And things such as despair and unpredictable emotions or challenges with emotional regulation can also be classic symptoms of trauma. Okay, so what about treating trauma? Now we have a better understanding about what trauma is, a very brief understanding, of course, about what trauma is. How do we best treat trauma? Well, of course, and I'm trying to remove as much bias as I can out of this, is that therapy is a fantastic option for treating trauma. But one of the keys to appreciate with therapy and trauma is to know that it's not a one-size-fits-all. A good therapist working with trauma, first of all, understands the subjectivity of the client, and although may have an understanding of trauma and an understanding of working with trauma in a therapeutic sense, they also understand that that traumatic incident is subjective and the individual is subjective. So that means a traumatic incident might affect that person in one way very differently to another. Likewise, therapeutic interventions might impact that individual in a different way compared to someone else. So subjectivity and appreciation of subjectivity in therapeutic interventions for trauma is really, really key. There are, of course, specific therapeutic approaches and modalities that can work really, really well with trauma. First one that we're going to talk about is CBT. Now, this is where there's a focus on an individual's thoughts and feelings. And CBT can help to create skill patterns to attribute and understand triggers that might lead to certain challenges when it comes to working with trauma. CBT looks at the meaning and the value that we attribute to certain events in our lives. Now, you can understand that if somebody's experienced a traumatic event, they're going to have a very high level of value, a very high level of precedence and focus on that traumatic event. But understanding a little bit more about what kind of value system they place on that traumatic event can be a key attribute to working in CBT with trauma. Now, the next one is exposure therapy, and this is kind of how it sounds. Now, this can be effective in steadily reducing that fear and that anxiety that somebody has over that traumatic event. Now, what I'm going to say here is, and be very careful, is that I've actually never conducted exposure therapy. I have read about it, I have studied it, I have been taught a little bit about exposure therapy, but I'm not going to pretend like I know exactly how to conduct it. And I can also understand that it might be very challenging to utilize exposure therapy with a traumatic event. For example, if somebody's come with sexual abuse, trauma from sexual abuse, or trauma from things like a war zone, for example, that's going to be really hard to utilize exposure therapy to help treat that. That's my opinion anyway. There'll be plenty of other therapists who are much more astute in exposure therapy, and maybe one day I'll maybe have some practical experience. But like I said, I'm not going to pretend to know or pretend to you that I know everything about exposure therapy, because I don't. Okay, the next one I want to talk about, and one of those therapeutic modalities that is so key and is really the basis of my work, but is often overlooked, is person-centered therapy. With high degrees of acceptance, warmth, and empathy, person-centered therapy can be hugely valuable for somebody who's experienced trauma and coming to therapy to work through that trauma, especially if this is the first time they've ever spoken to anybody about it. Now, although that's a lot to do with the mind, and therapy is a lot to do with the mind and our emotions and our feelings, recent research has established that in therapeutic interventions, there's an oversight of how the body reacts to trauma. As a result, things like yoga and Pilates, there's more research coming out to establish how those kind of interventions can actually be really effective in treating trauma as well. So that's maybe something that we need to think about more in the future as therapists, and also people who have experienced trauma, maybe need to look more into those therapeutic alternatives. Okay guys, thanks so much for watching this week's episode of GetPsyched. This week we've been taking a look at what trauma is, we've looked at the symptoms of trauma, the different types of trauma, and we've also looked at treating trauma and how best we can utilise therapeutic interventions and what therapeutic interventions are best for actually working with trauma. Guys, thanks so much for watching. If you've been enjoying the videos on GetPsyched, then make sure to hit that subscribe button. You can hit that little bell next to the subscribe button. You can also check me out on social media, on Instagram, on LinkedIn, Facebook and Twitter. Make sure to follow GetPsyched on all those different social media outlets and you'll get more content about what GetPsyched is doing. GetPsychd's also launched our brand new website. We've a new updated website that we've just launched that we're super excited about. And we've actually launched a new e-course on how to brand yourself as a therapist or branding yourself as a psychologist. So you can head over to the website, and right now I think you'll still get that 30% discount if you're interested in buying it. Make sure to check that out guys, and hopefully catch you next week on our next YouTube video. Thanks.